All right, my name is Dave Sontag. I'm the Executive Vice President of Luminu, and I'm here with Dr. Tom Lewis from Real Health Innovations. He's going to talk to us about some population health markers and ways we can move the needle on chronic diseases. Tom?
Thank you, Dave. What I want to talk about today is, so basically we have a Rolodex of IP that's really geared towards measuring chronic disease and then applying these measurements to managing populations, whether it be in the corporate world or other parts of the private sector or the public sector. Some of the initiatives we have going on right now are in Marion County, Florida, particularly working with homeless and more indigent populations, more underserved populations through churches. We're working with population groups in South Central Indiana. An initiative we want to pursue recently in the media is Tennessee talking about their $5.6 billion healthcare burden, excluding cancer and Alzheimer's disease. And so when you look at a state as large as Tennessee with 4 million plus people, how do you wrap your hands around that problem? And the way you do it is understanding that a small percentage of the population contribute significantly to the total cost. In fact, the figure is 5% of your sickest people cost 60% of your healthcare spend. So you don't have to go after 4 million, you can go after a 1/20th of that, and you're still impacting 60% of your healthcare costs. So I picked this particular slide because it talks about population health committing to greater risk, and what wellness programs do is they make the well people more well. We need to find, identify, and work with the truly sick, and a little wellness program can't move the needle on those people. They're multiply chronically ill. So that's the introduction, a long-winded one. And so we're working on community-oriented health creation initiatives hopefully in Tennessee, but right now actively in Indiana. We're meeting with the mayor of Greensburg in a week or so, and working in Batesville, small towns but important towns, from a Wellville perspective, if you will, and Marion County, Florida, which has 345,000 people, that there's an initiative to make the whole population well. So I have this slide because the cornerstone to the whole program is measurement. You can't just go out willy-nilly and do an A1C. You have to be more robust in terms of your measurements so you can really identify the portfolio of illness that people have. So really we've developed an evidence-based wellness and medicine program, and risk stratification is at the cornerstone, so we know who are among the 5% or the top 20%, which cost 80% of your spend, things of that nature. So I just want to show you results we're getting in a small cohort in South Central Indiana. So here's a person with debilitating psoriasis that we reversed. This lady wasn't sure how much longer she could work, but now she's completely back to normal, and I want to show you how we move the needle on her. So she had psoriasis, as we see on the right-hand part of the screen, being treated topically and with antihistamines, standard of care. We took over her care. We did nothing on the external for her, just worked the external, no pharmaceuticals. In fact, we removed pharmaceutical burden from her life, and in 5 months we saw this kind of improvement. This is a rheumatoid arthritis sufferer, also type 2 diabetic. He said he couldn't bend his hands, or fingers rather, to make a fist. Now he's able to play with his grandkids. He's not in pain anymore. And these are home pictures. We didn't get involved with this, but you can see a tremendous difference in this individual. Now he's a line worker in the factory, no issue. He's working, he's pain-free. Here's a gentleman on insulin. It's costing him a lot of money. We got him off his insulin. He's lost weight. Good outcome. We reversed insulin-dependent type 2 diabetes.
Hey, Tom, I got a quick question.
Sure.
You said you'd worked with them externally, but I think you meant to say you're working on changing the internal terrain of these folks. Is that right?
Did I say that? Yes. Thanks very much, David. So, the standard of care worked externally. We did nothing externally. We simply changed the terrain, the milieu on that individual.
That's awesome. Thanks.
And, a lot of people look at an autoimmune condition like that and think you're going gluten and dairy free. none of it, which was the case in that particular lady, just because of, an older woman, and it's just harder to make her affect those kinds of changes. So we did other things. Of course, we try to reduce gluten, dairy, all that stuff, sugar, all that stuff. But you don't have to go. You'd be surprised. You don't have to go all the way sometimes to make people well. And this is strictly a coaching program.
Exactly. And that was my point there, is from a population management perspective, you're not talking about having to prescribe expensive drugs. You're talking about getting the right precision medicine, coaching recipe, if you will, for helping them tune their body optimally through just things like lifestyle changes.
Correct. And if you look at the drug ads, particularly with these monoclonal antibodies designed for autoimmune disease, I mean, it's like pushing a mattress underwater. I mean, it's going to pop up someplace else. It's not the right approach. So one of my big goals is to get everybody off their monoclonal antibody drugs, because they're just not effective. They're not at the root cause, and we're at the root cause. But on this slide here, David, the true underlying cause of the silent killer blood pressure is really kidney dysfunction. And so this lady came out of stage 3 kidney disease, obviously lowered your cardiovascular markers when you did that. Once again, strictly a nutrition, lifestyle coaching program that did this. This is one of my favorite slides. You really can't show depression. The beautiful thing about the arthritis and the psoriasis is you can see outward manifestations of internal disease. But this lady had been at a very low point, in her mid-40s, health spiraling out of control, depressed, migraines, very fatigued. All her tests were normal. But depression is this sort of amorphous. It's really organic, but people look at it as being amorphous. 9 months later in our program, she's off her antidepressants. Most of the things impacting her health previously are either completely gone or rarely occur, and she has her life back. So these are the kinds of things. How ubiquitous is depression? And intimately tied to depression, as we saw in the rheumatoid arthritis person, is pain. And, we have this opioid crisis. And a lot of these people, if we can change their milieu, their addictive behaviors go away, and their pain thresholds are increased, and their pain burden is decreased. So here's a simple thing, reversing acid reflux. Very common thing, but it affects downstream so many conditions, from autoimmune, fatigue, pain, all that stuff. So we got her, this lady, off her GERD, her cholesterol meds. Taking CLO, sort of our secret sauce, is grandma's formula, cod liver oil, the medicinal that was taken in the Viking era to relieve pain in finger joints, for example. So joint pain, once again, the root cause is the sugar, is the GERD, is the whole diet. So we don't have to treat with NSAIDs. These are masking agents. We need to lower your cup, lower your vessel of total body inflammation. The pain goes away. So these are things that can be done very much on a population basis. No doctor involved here. We have doctors, but all these participants in this program were strictly managed through coaching. So here's the challenge, David. This is from a Employee Benefits Health prominent magazine. If you look at the highest cost individuals, $145,000 per year, that's $12,000, $15,000 per person per month. An $8 wellness program ain't going to move the needle. $8 per month versus $15,000 per month. Let's face it, it's barely the tip of the iceberg. You're going to take deeper dives with these individuals, and you have to have a robust, high-touch coaching program. But once again, this is 1% of the population. So in 1,000, there are only 10 people like this. But you've just moved the needle significantly on overall healthcare spending. So that's how we manage population, is by measuring who are the high costs. And we have a system, it's not just claimed, but we run a risk calculator, an HRA, which we've developed, which is an intelligent HRA that gives you a raw score and allows us to stratify highest risk to lowest risk. So this is from Harvard Medical School and Kaiser. It's the same thing. The chart on the left shows you we need to be focusing on these highest risk, high risk, and medium risk populations. And that accounts for only 20% of your population, but 80% of your costs. And as we go up, 5% is 60%, and 1% is approximately 34% of your costs. So here's the value proposition in our program. And I know I'm talking about Wellville and sort of benevolent programs, but there is a cost. And what we're saying is, if you look at an entire population, say out of 100, our cost to move the needle significantly is $31 per person per month. But you can see we're not putting a sort of a homogeneous amount of effort into any given individual. So for the 1%, we're spending about $250 a month to move the needle. Supplements, coaching time, further contact time, consultations with the doctor. And then that goes down. The amount of effort you need to put to move someone into a better health regime goes down. And for the very low cost people, we would just involve them in group workshops to educate them on root cause of disease and make sure they don't head in the wrong direction. So it's a very simple, robust platform. So how our solution works quickly is Living Profile is an HRA that my Harvard medical school partner and myself, I'm an MIT PhD, developed. It gives you grades from A to F, but we get a raw score, helps us stratify the highest risk to lowest risk. And then the chronic disease temperature is simply a way to look at labs from a different perspective. We're not looking for a blazing fire. We're looking for smoldering inflammation. And the chronic disease temperature measures that very accurately. Now we're accountable to the patient and the patient's accountable to us. We give them one number for a multiplicity of labs, your chronic disease temperature, which allows us a barometer to see how we're moving the needle on individuals. And of course, this is a participatory program. The person has to be engaged. And then for the small percentage of people who aren't improving, we need to do advanced diagnostics to find out what ball and chain is holding them back, even in their terrain, from getting well. So, complicated snake diagram, but basically this is our process from assessing risks to biometric screening to actions, measuring outcomes, and then it's a feedback loop. It's an artificially intelligent loop that helps us go from health outcomes to understanding of how they got there and vice versa. So it's a process of continuous improvement. We'd like to get many, many clinicians on this program to help accentuate our skill at driving outcomes and predicting outcomes. Here's a dashboard for a patient, for example. They get an F for their living health profile score, so they have a lot of risks. Their chronic disease temperature is high. They have an action plan. Some are available to the participant. Some are held back for coaches and doctors as they become more medically intricate in terms of the solutions. And then what we're showing here is part of the dashboard, and you can see at the bottom a bunch of actions that have been assigned to the individual. These aren't big things. These are little things. This isn't quit smoking. This is, what are the 10 factors in your life that are contributing to chronic inflammation? And let's pick a couple of those to start from and get some early successes and feel good about ourselves. And then maybe we can move on to embracing some of the more complex risk factors in your life. So how it's worked out, David, is that when we plot your living profile grade on the x-axis and your chronic disease temperature on the y-axis, we get a linear curve, a straight line. And the rise over run is essentially 1 for 1. So participants immediately see, when we explain, who has control over your blood labs. And the chronic disease temperature is really a mortality indicator. Who has control over your mortality? And regardless of socioeconomic and educational status, they all say, I do. Because I can move my lifestyle needle from an F to a D minus to a C to a B, and that statistically, and we've proven it with labs, lowers your chronic disease, inflammatory risk physiological profile. So it's an evidence-based approach because it's all driven by the laboratory values, and almost no doctor can argue with the benefit of lowering C-reactive protein, the benefit of bringing white blood cell counts into a better range. These are simple measures that are accurate about health. So this is sort of a corporate slide, but it shows you that there's great opportunity to reduce costs. And the only way to truly reduce costs is to create health. So even if we just affect a 5% year-over-year reduction in healthcare costs compared to the approximate 6.5% increase that we're seeing based on 2016 figures from Forbes magazine, that by year 5, your costs are 1/2 of what they would be if you've done nothing. Just a simple ROI of 5% year over year. So that's what we're looking to achieve. In 1 million people, we're working with 50,000. That's 5%, or even 10,000, 1%. If we can help them, we've moved the needle by a full third in terms of cost, and what we've done in health is immeasurable. So that's who we are, David. We're a health creation company. We want to work with large populations, and we want to work with individual doctors to affect this program. And of course, what we bring to the table is augment your medical practice with health coaches, and our program guides the coach in terms of what to do, how to measure outcomes, and deliver good care.
Thanks, Tom. That's exciting. I also know that you have some advanced diagnostics that go along well with what we're looking at with the photon-enhanced neurofeedback. We'll talk about that later on. But I do want to allude to that in addition to what you're doing with the population-based health, you do have some really exciting things, the window through the eye into chronic disease. So we'll stop there, and we'll engage with that later. Thanks.
Thank you.